morning.
How are you?
I'm good. How are you?
I'm doing good.
How can I help you?
I have an appointment today.
Okay, what's your name?
Louise Parker.
Alrighty. If you can just take this and go sit over there and fill it out for me, and just bring it back when you're ready.
Okay.
Thanks. Thank you.
Miss Parker? Yes, right this way. Okay, Miss Parker, now that we have your blood pressure and weight, what brings you in today?
Right now, I guess I'm kind of curious about birth control. I've heard a couple of them on TV, especially one containing progesterone, and I was wondering if you could tell me a little bit more, if I could find out more about it.
Sure. What we'll do is Dr. Tenenbaum, I'll let him know that you're interested in talking with him about that, and he'll come in and have a conversation with you and talk about the different options, and then he'll give you a minute to get dressed in the gown, and I'll come back in and we'll do your exam.
Okay, thank you.
Okay.
Mrs. Parker, I'm Dr. Tenenbaum. From what I understand, we'll be discussing birth control.
Mm-hmm.
All right, and you had mentioned a Progestin Only
Yeah.
birth control that you had heard about over the TV, and we'll talk a little bit about that, but we'll also talk about implants and shot possibility. Printed off some information for you and highlighted some pertinent information. With the Progestin Only, it must be taken at a specific time.
Okay.
If you're over 3 hours late, you have to use an alternative birth control, such as a condom or something else. And if you forget it for a day, you have to use that alternative until your next period.
Oh, okay.
The implant, we will implant into your arm.
Okay.
It's about the size of a matchstick, and this will prevent pregnancy up to 3 years.
Huh. Okay.
This is a very effective birth control, but there are issues coming off of it. It can cause infertility, and it's one, if you don't want to be pregnant, it's recommended. But if you have any hopes of getting pregnant, we kind of recommend the short-term pills or shots.
Okay.
The shots, which the Depo-Vera, is effective for 13 weeks. You get them about every 3 to 4 months. Okay.
Okay.
All these are very effective in birth control. Some side effects are going to be irregular menstrual cycles, spotting or bleeding between the menstrual periods, sore breast, headache, nausea, dizziness, bloating or weight gain, and possibility of no menstrual periods.
Okay.
With the Depo-Vera, though, we're concerned with bone loss, and that it just depends on the age. If you're a teenager, we usually don't give it, but at your age, you're more adequate to receive this.
Okay.
Do you have any questions or concerns?
Not really. Do you mind if I take home some of this information?
Sure.
Thank you.
And if you decide before we finish the exam and all that, which one you want to do, or if you want to look at it, that's fine. Just let me know, and we'll reschedule a visit, and you can come back in, and I can get you some birth control.
Okay.
All right. Thank you.
All right. Thanks.